Good evening. My name is Steve Candelaria. In 1982, I was at a fair in San Juan County, near Farmington, New Mexico. I saw a booth that was taking blood pressure. I approached their table, and the young lady took my blood pressure. She said, "Wow." I asked, "What seems to be the problem?" She says, "Your blood pressure is very high." She called a gentleman over that was standing there, and they looked at the figures, and he wanted to take me to the hospital right away. I said, "No, I'll go to the hospital on Monday, or go to the doctor on Monday, rather." And, well, as it turned out, the doctor checked my blood pressure, and he put me on medication. I asked the doctor, "What causes high blood pressure?" He said, "Well, there's many factors involved in this." I asked him, "Well, what's causing it on me?" He said, "Well, I don't know." I asked him several questions, and he did not really give me an answer. I wasn't satisfied with what he told me. However, I did take the medication and left before I got thrown out. I thought that I wasn't satisfied with everything he said. So, but I kept on going. I just wrestled along with it there for about 26 years. In 2007, I had a heart attack. Well, since then, I have been studying more about this situation, and I know now that my blood pressure was a symptom of something going wrong in my system. However, I had already had a heart attack. I went to the hospital. They put 2 stents in me. Well, when I got out of the hospital, I got home, and a friend of mine that had been trying to get me into Synergy came over to see me, and he said, "You need to get on this." He had been trying to get me involved in that for 2 years, and I thought I was healthy. I didn't know there was something that bad going wrong with me. Well, I got on the product, and after 3 visits to the doctor after the operation, I went in and I told the doctor that I was going to quit taking the prescription drugs that she was giving me. Well, as it turned out, she asked me, "What are you going to do? You probably have to take this medication the rest of your life." And I told her, "Well, you know, the heart attack didn't kill me, or hasn't yet, but if I keep taking these drugs, I'm afraid they're going to kill me." And she said, "Well, what are you going to do?" And I gave her a brochure about the Synergy product, which included the Proargi9. And she said, "Well," she says, "you have my phone number, and you can, you know, you don't have to come back anymore." So, but in February of 2008, she called me, and she asked me if I wanted to get checked. I said, "Well, I suppose that'd be all right." I says, "When do you want me to go?" She said, "Well, first I'm going to send you a prescription, and you go down to your hospital there in your town and take a blood test and have them faxed to me." Well, about 4 days after I took the blood test, she called me again, and she says, "Well, I'm not going to give you an appointment." She says, your blood work is in very good shape. There isn't anything that I can do to help improve that." Well, I had started to take the Proargi9, well, when Ken went knocking on my door. So I had been taking it then for probably a couple of 2.5 months. Well, that turned out that, as it turned out, I was recovering real fast. I was doing real good with this. So after seeing what it did for me, I took on a distributorship and went ahead and started to try to sell this. I have I have a lot of respect for Ken and the medication. I just love the medication, and I kind of have to tell you a little more about myself, because I'm kind of getting lost here, but we'll find a way here and we'll get there. Let me think just a little bit. Boy, I'm totally lost now.